It makes sense that there are specialties in medicine. Pediatricians for children, cardiologists for heart patients, internists for family medicine, just to name a few. So it should come as no surprise that there's a specialty for aging adults. But what might be a surprise is how special the specialty of geriatrics is. The very special Dr. James Campbell is here to explain. Dr. Campbell is a geriatrician with Metro Health. Welcome to the show.
Thank you.
Now, when we're talking about geriatrics, are we basically talking about older adults? Is it just age?
It's not really only about age. It's partially about what's the reality for that particular patient. So you may have somebody who's 55 but would benefit from a geriatrician because they have illnesses like dementia or other things that are common in older age. On the other hand, many people who are over the age of 75 or over the age of 80 would definitely benefit from help of a geriatric specialist.
Okay, so it's not just being 70 or 75, it's maybe dementia or...
we think of the 3 Ds, so dementia, delirium, depression, really the common things that are very life-threatening and very sort of quality of life-threatening for these folks. You really want to figure out how you can take their life and make it the most enjoyable. Make it so that they can enjoy and get good function with whatever physical problems may happen to exist. Our goal is to make it so functionally they can love their life.
That's an important goal. Can you give us an example?
The example I love is sort of when we sit down with a patient and we ask them, what would you like to do? She may have 5 or 6 different illnesses, high blood pressure, heart failure, diabetes, glaucoma, osteoarthritis, whatever.
Oh, lots to handle.
Yeah, and many of those are diseases that we can't quote-unquote cure. We can't take the disease away. But we can sit and say, okay, so what would you like to accomplish? What would you like to do? And my favorite answer was a woman who basically said to me, she said, well, I'd like to walk down the aisle at my granddaughter's wedding. There you go. That's a goal.
Concrete goal.
Concrete goal. We negotiate the rules, okay? Are you allowed to go down the hall with a walker? Oh, of course not. Can you go with a cane? No. Can you lean on the person sitting? Yeah, that would be okay.
All right.
Okay. How many steps to get into the church? How far is it? And then we really work with sort of what can we do to optimize her health? And a lot of that is non-pharmacologic, seeing whether she's getting appropriate therapy, whether she's getting appropriate strengthening to improve her osteoarthritis, working with her medications. Some of her medications may be, too much, and so that she's dizzy when she stands up, and that makes her feel uncomfortable walking. So we work with those medications. And we work really to sit towards that functional goal. And then at the end of the day, she walks down the aisle at her granddaughter's wedding, and she's totally happy.
Yeah.
She's very pleased with the result because she didn't really walk into my office saying, Doc, I want you to take away my arthritis. She knows her arthritis is still going to be there. But she says, this is what I want to do, help me do it.
Couldn't her primary care physician do the same kind of work with her?
There's a lot of great primary care physicians out there, and they can do a lot of this work. There are times, and particular times, where you may sense that a primary care physician isn't sort of specifically able to deal with certain issues. We look at particularly things like large issues in polypharmacy, too many medications, issues in the management of depression with other medical illnesses. As we talked about, issues with dementia, trying to make sure that you're working and getting somebody so that their memory works as best as can be possibly worked out. As well as things like urinary incontinence, osteoporosis, people who have frequent falls. These are the kind of things that a geriatrician is specifically trained to work with. So in those cases, and oftentimes we work in conjunction with a primary physician. They may have a primary physician they know and love, seen him for 30 years.
But you can add a whole new perspective and dimension to that care.
Exactly.
That's a good thing to know. So when it comes to focusing on your priorities, a geriatrician may be just what the doctor ordered. To find out more, use the information that's coming up next. My thanks to Dr. Campbell for joining us today.
If you are 55 or older, we invite you to join Metro Health Advantage. Membership is free and provides access to free health education seminars, Metro Health discounts, and a wide array of helpful services, including expert advice on Medicare. To join, call 216-957-2800 or visit metrohealth.org/advantage. Next, help is now available to to find the best care possible for your loved one.